when we put an implant, it's important we have to assess the bone, and that is mostly from the x-rays. And the reason for that, because in the jawbone there are certain nerves that we want to avoid, certain cavities or sinuses that we don't want that implant to encroach in there, because it will cause problems. So in the upper jaw, in reality, we are concerned about the maxillary sinus, which is a big cavity in the jawbone. So we want to make sure that that implant doesn't really perforate or encroaches into the sinus. If we don't have enough space in there, then what we need to do is something called a sinus lift or sinus grafting. Basically what we do is that we either increase the amount of bone inside the sinus by either coming from the side of the sinus or through the socket itself, which can be explained. It's a bit technical, but can be explained to the patient. So we have enough amount of bone to put the implant in there. Also, we have to make sure that we do not really go through the nasal sinuses as well, above the front teeth. So, and we have to always to make sure that we have enough amount of bone, like when we put the implants. So we do not really encroach on the neighboring teeth or any other anatomical features that is important. In the bottom jaw, what we have mostly is, apart from the size of the bone, which is important, there is a very big nerve that is called the infraorbital nerve, and that nerve at the end will have like a loop in there. So we want to make sure that those implants are positioned in a way away from the nerve, so we don't have like numbness, or which we call paresthesia, or damage to the nerve or any of that. So it is important to assess all of that by the x-rays, and the best way to do that is by cone beam. That's why the cone beam is the way to go before doing any implant. A cone beam is a machine, it's like scanning the bone, so we're having a three-dimensional picture where we see exactly the height and the width, and it's like cutting slices in the bone. So you can play with certain software to put the implants in the right position even before you go on and put it in the mouth. So it's a way to plan that case properly before you do it, and it gives you, and also it shows you the landmarks in there, and the measurements can be done very easily on the x-rays and on the software. So most of the time we send the patients to a certain radiological lab where they take that x-ray, and we found a place where they can do it on bulk billing, so it doesn't really cost them that much. And then the lab will send us a hard, like x-rays and a DVD that we put it in, and we have certain software that can basically play with to measure the implants and try to work out how the implants will look into the mouth. So it's a very important way of doing it before we go on and raise a flap or put an implant in the patient mouth.